Ladies and gentlemen, welcome to the 2021 Annual Public Meeting for the Murrumbidgee Local Health District, which is being live streamed across the district today. My name is Millicent Brown, Executive Services Manager, and together with my colleague, Temora Mayor Rick Furman, we will be your MCs for today's proceedings.
Thanks very much, Mill. It's a real pleasure to be with you here today, that's for sure. To begin our formal proceedings, I'm really delighted to introduce to you a very special lady as far as our district's concerned. Ladies and gentlemen, please welcome Auntie Isabel Reid.
I'm Auntie Isabel, Wiradjuri Elder, and I'm here to present the Welcome to Country, which is so very important and also very necessary, as it demonstrates an ancient tradition to welcome visitors to our ancestral lands, which has been conducted over thousands of years to officially welcome people and to identify who we are and who you are. I would now like to acknowledge and pay my respects to the custodians of this land, the Wiradjuri peoples, whose land you are gathered on here today. I also wish to acknowledge our elders, past, present and future, for they hold the memories, their tradition and culture of all Aboriginal Australians. So in recognition and respect for all Aboriginal people, our culture and heritage, it gives me so much pleasure to welcome you all here to the land of the Wiradjuri peoples. Thank you.
Thanks very much, Auntie Isabel, for those very warm and welcoming words. It's my pleasure now to be able to introduce our keynote speaker for today, Emeritus Professor Jill White. Professor White is recognised for her work in advocacy for nurses on a national and international scale, working with the World Health Organization in Geneva and the International Council of Nurses on nursing voice in health policy. And Professor White is an independent consultant with the University of Sydney School of Nursing, and we thank her so very much for her time here today.
Good afternoon. My name is Jill White. I'm an Emeritus Professor of Nursing and Midwifery at the University of Sydney, and I've been invited to speak with you today about 2021, two very unexpected years, and how has nursing fared through these strange times. So let me just share my screen with you. This will only take a second. So before I begin, I would absolutely like to acknowledge the traditional owners of the lands on which we meet this afternoon, and pay my respects to elders past, present and emerging. I'd particularly like to acknowledge the peoples of Wiradjuri Nation, where I had the privilege of being born and bred, in Diamara. So who am I as I speak to you? Well, I met some of you just on 2 years ago at this session. Since that time, so much has happened in all our lives, some of it for wondrous and good, amidst absolutely dreadful circumstances. In my life, there are these two small human beings who've been born through the time of COVID. Ollie, my grandson, born at the very beginning of COVID, and Annie, my granddaughter, born just 6 weeks ago. Absolutely steals one's understanding of the knowledge of a effective and efficient health system. When I had the privilege of speaking with you in October 2019, I was talking to you about the Nursing Now campaign and the importance of allowing nurses to work to their full scope of practice. I talked to you about the fact that there had been a report done, a global report done from the UK, that indicated that at a global level, nursing was underutilised and undervalued. And if there was any chance that we would get to be able to provide appropriate healthcare to all people in the world, that it was, yes, important about increasing the numbers of nurses, but crucially about making their contribution properly understood and enabling them to work to their full potential. And that nurses could not do this by themselves, that politicians, non-nurse leaders and others had to work with them to create the radical change that was needed in how nurses were both perceived and in what they were permitted and enabled to do. And we anticipated 2020 as a wonderful year. It was the World Health Organization proclaimed Year of the Nurse and Midwife. So we headed into 2020 for a year of celebration, for making political strides, public strides in the understanding of what contemporary nursing was about and gaining media attention. But as we know, when they said 2020 would be the year of the nurse, they weren't joking. It most certainly was, but not in the way we intended. Some of the work of the Nursing Now campaign with WHO, the World Health Organization, was able to continue. It was indeed the International Year of the Nurse and Midwife. And we had the first ever State of the World's Nursing Report at the World Health Organization. The first time there'd been an accounting for how many nurses were at what level, educated to what level, and what the shortfall was, both now and in projection. And this led to the World Health Organization Global Strategic Directions for Nursing and Midwifery that came to the World Health Assembly in 2021, so May this year. And in that report, there was a commitment from every health minister around the world to report on what was happening in relation to nursing education, jobs, leadership, and service delivery. And so a lot of the recommendations from the Nursing Now campaign picked up in that. But of course, the World Health Assembly didn't look like this, which is what it usually looks like. Thousands of people in this fabulous venue in Geneva. It was, unsurprisingly, in 2020 and 2021 virtual. But what about in Australia? Well, I don't need to tell you the fears, the terror that we went through with the bushfires, and absolutely affecting the Murrumbidgee area as those fires came over the hills towards Batlow and Tumut and Tumbarumba particularly. And of course, no sooner did we have the fires than we were hit with COVID. So whilst nursing wasn't what we anticipated, was it what we needed? Well, just before I get into this, I just wanted to share with you one of the things about COVID. It did some horrendous things, but it also brought about some of the best cartoons and jokes I think I've ever seen. And this I wanted to just share with you, my very favourite. You all know about this little piggy went to market. What happened to the next one? Stayed home. Terrifying, terrifying things hit us, particularly for health professionals, where the research was not clear in the early days about the mode of transmission, or what we had to do in relation to personal protective equipment to stay safe ourselves. So what did we need in a health workforce in a crisis, particularly from our nursing workforce, given that that makes up much more than 50% of the health workforce, both here and globally? So we need a workforce that's agile, we need a workforce that's trusted, and we need a workforce that's absolutely able to get the resources for the people who need them, where they need them, and when they need them. So let's just take a little look at some of these. In relation to agility, that ability to morph, to function effectively in novel circumstances. Well, one thing about nurses, we've always been agile, and that agility absolutely came to the fore as we had the scorching of the Batlow apple, as we had the floods, not all that long afterwards. And it raises the question that I think the community doesn't think about. What happens to patients and residents of health facilities when a fire or a flood approaches? Who organises evacuations? Where to? With whom? How? And when patients leave or can't leave, who stays? And the stories from the Batlow and Tumbarumba evacuation of the health services are absolutely heartwarming and heart-stirring to hear, as nurses organised for patients to come from their area to safe hospital health facilities. And that was distributed right throughout the Murrumbidgee Local Health District, depending on the need of the patient and the problem that they had. And some of these nurses actually went with their patients because they were unsure that the patients would be safe in environments that they didn't know, particularly dementia patients, for example. And these nurses had the opportunity to leave their work, to be with their families, but the majority of them chose to stay with their patients. True hero stuff, I think. And what happens when borders close? Well, particularly in our state, we had health services that were looked after on the southern border by Victoria and then the northern border by Queensland. And so there has to be then a rapid response to care for the people, in this instance, for the people in Albury and the surrounds, when there couldn't be any crossing of the border. And Victorian Health had been actually responsible for the care of the people in Albury. All of a sudden, it falls to Murrumbidgee Local Health District, and of course to more than nurses, but nurses in particular. So the agile workforce, well, out of the woodwork they came. When people couldn't come from across the border from other areas, we had to rely on the people that we had here. So the assistants in nursing, those who'd done the vet qualifications while they were at school, came to be helpers and runners. Retired nurses came back to give vaccinations. And so Murrumbidgee was one of the areas where all of the immunisation were given by authorised immunisers. Nurses accepted redeployment into roles they'd never dreamt of taking on before. They had to leave their substantive positions, knowing that there wasn't a backfill, so their job would still be there, mostly not being able to be done. And at times, I know that many of your nurses worked up to 3 months straight without a day off. And all the while that this was happening, patients with mental health needs, chronic disease issues, and acute care needs were all still being attended to, often by virtual clinics. So nurses through the last 2 years, very different environment. From the pop-up drive-through testing clinics, sometimes pulling up in minivans on the side of the road or at a park. And I know one circumstance where they had to set up tents in a park that had no water, no toilet facilities, 40-degree heat. And day in and day out, the nurses did that testing. And in this region, in this district, over 60,000 vaccinations have been administered by your nurses. And all the while that this planning, these logistics, this resource allocation was having to happen in the background, often by nurses not necessarily in nursing positions, but who'd moved into logistics and resources and operations, there had to be the planning and the scaling up for the potential for an outbreak within the region. And we didn't know where that would be, if that would be. And what would happen? Would you have a designated hospital that was a COVID hospital, or would every hospital have a COVID ward? And all the while, the research was constantly changing, and so the plans had to be changed. So agility, plus. Trust. Trust such that people have confidence in what's being said and done, and confident that they will not come to any harm. And nurses actually work, because of they are members of a profession, they work with a particularly professional moral compass. And I do like this description by Janice Morse, is a New Zealander, and some of her colleagues. So the capacity to decide with intelligence and compassion, and given uncertainty in the care situation, well, that was in this case, drawing as needed on a critical understanding of the codes of ethical conduct, clinical experience, academic learning and self-knowledge, and with the ability to anticipate consequences and the courage to act. And indeed, the courage to act was shown in spades through this time. So that working with a moral professional compass is actually, for the patients, a flip side of trust. When you see this in your nurse, you have trust in that person. And that trust enables a communication that is often unpalatable in a crisis situation. And so that trust has to be established beforehand so that you will respond immediately and with trust and goodwill in a crisis. And I have to say, for 19 consecutive years, globally, nurses have been seen as the most trusted profession and continue to be so. And indeed, we saw this outpouring last year. Flyovers, royal family clapping. Easter last year and the year before, we had more chocolates delivered to hospitals than you could ever imagine. So there was a sense in which the public started to see, in many places that particularly had COVID, what it was that nurses were doing. And indeed, even Boris Johnson, who said they were watching, they were thinking, they were caring, and they were making interventions as needed. And he saw that the two nurses he pointed out in particular were responsible for saving his life. Little scepticism on behalf of some of the British nurses. We're recording the applause to play to the government when the pandemic's over. And in fact, they're having a terrible issue in the UK at the moment with the government living up to its promises. The third most important thing then is that to be a workforce fit for the crisis, they needed also to be influential. And by influential, I mean that the workforce is heard in policy making and successful in procuring resources. And the International Council of Nurses, based in Geneva, a group with whom I've done much work over the years, in September of 2020, did a survey of their member countries, and they found that in half the countries there was a shortage of appropriate personal protective equipment for nurses in term care facilities. And a third of nurses experienced a shortage when they were working in community settings. And I know this happened in Australia. For many of the privately practicing nurse practitioners, they found great difficulty in being able to obtain appropriate PPE. And in fact, it took in Australia until June this year that there was an agreed protocol in relation to personal protective equipment. So the gowns, the masks, the shields, yeah? That need for a particular sort of mask that was fit tested for the face, because masks don't fit all faces in the same way, for people working in high-risk areas. And we know that this lack of PPE has had consequences. We know that this is a very conservative estimate from the World Health Organization, that over 115,000 healthcare workers, and remember nurses make up more than half of these, have died during the pandemic. So that safe working environment, absolutely first priority, including the staffing level. So how many nurses to how many patients, that's been delivered by research from Queensland. And Tim Porter O'Grady, who's written a lot about leadership and leadership in nursing, says that nurses at all levels should see that policy and politics, that it's something that they should be obliged, I would say, he said, obligated to shape, rather than something that just happens to them over which they have no control. And indeed, this is now recognised by nurses who used to think that their only concern was the nurse-patient relationship. What did I need to do for my patient, the nurse-patient relationship, without thinking or realising that, in fact, everything that they could do with their patient, their facilities, their resources, their work allocation, was determined by health services, which in turn were constrained by enabled by ministries of health, by government decisions, by national decisions, and indeed by things that happened at a global level. And so nursing input throughout these layers was absolutely critical to, in fact, being able to function with the patient at the bedside. And so nurses have always been good at seeing the detail of the immediate surrounding, the immediate needs of their patients, the circumstances of their patients, but they've been less aware of the need to see far, to see over the horizon what might be coming, what are the logistics tracks to be able to get what I need, who's making decisions about what it is that I need for my patients, who's giving advice, and other things that I know being included in that advice to government. And so in our area, we have enrolled nurses, we have registered nurses, you have a growing number of nurse practitioners, and absolutely came to the fore through COVID, and interesting, a greater recognition by the medical profession of the collaborative way in which they can work with nurse practitioners rather than feeling that they were a threat in any way, in all sorts of circumstances, but not always able to work to their full scope of practice. And I just want to remind you of what we saw earlier from the Nursing Now report, from the Triple Impact report, where they said it is about making sure the contributions properly understood and enabling nurses to work to their full potential. Politicians, non-nurse leaders and others must work with them to create radical changes in how nurses are perceived and in what they're permitted and enabled to do. And some of the things that prevent nurses from doing this, some of it's legislation, some of it's regulation, some of it's just local policy, some of it's myth, some of it's culture, a lot of it's turf protection, and some of it's benign neglect. And so in many ways, it's up to nurses to get on and do something about it, but we need your help. And in fact, these days we're finding nurses everywhere. We're finding we've got a current in Wollongong, our Vice-Chancellor, the Deputy Secretary of Health, Susan Pearce, is a nurse, the Federal Secretary of the largest union in Australia, Annie Butler, is a nurse. One of the faces you've seen very recently, Julie Lisk on drum and many other things, a World Health Organization advisor on vaccines, is a nurse. Your own CEO has a nursing background, as have half of the CEOs of local health districts in this state. And we have most local health districts have a senior nurse as a board member. And Mary Curella, you may in fact have seen before as a frequent commentator on the drum. But we also at the moment have two nurses in federal politics. We've got Jed Carney and the wonderful Helen Haynes, the independent member for NDI, who's really pushing that independent commission on corruption. So we now have nursing absolutely still committed to that absolute nurse-patient relationship at the bedside, but also trying to do more for the over-the-horizon things, making policy at a more senior level. So we need nurses at every one of these levels, and we are starting to get there. And why do we need them? Because they hold your cumulative story of your experience of health and illness. They're a bridge between you and the health system. And so they're critical to policy. So looking for a career change, either for you or one of your children, do I have the future for you? So thank you very much. It's been a wonderful opportunity to talk with you again today. So thank you. Thank you to the nurses of this district, and thank you to Julian Clift, Carol Dallinger and Denise Garner for sharing their stories with me. I really appreciate it, and I hope to see you soon. Bye.
Thank you so much, Jill. It's really great to hear about the work you do. As a fellow nurse, I have so much love and respect for your advocacy of nursing. I'd now like to invite our board chair, Dr. Thomas Douch, to say a few words. Dr. Douch commenced in the role of board chair earlier this year. He is an experienced senior rural clinician with a background in strategic planning, policy development and leadership. Following a time in the Australian Army, Dr. Douch trained as a general practitioner and is currently working as a GP in Young.
Hello, my name's Tom Douch and I'm the chair of the Murrumbidgee Local Health District Board. I've been in that position since July this year. I'd like to welcome you to this annual public meeting. Even though we have to do it virtually, it's still good that you're able to attend and participate in an important event for Murrumbidgee. Hopefully next year we might be able to do a bit of face-to-face as well, but I suspect this virtual component will always remain with us because it gives some people an opportunity to attend and participate who probably don't have time otherwise to get to see us. I'd also like to take the opportunity at this stage to say thank you and to acknowledge my board. They've been very supportive of me and I thank them for that, but I also thank them for the work that they've done in undertaking the role of the board. Each of my directors has been asked in the past, and I've been asked too, what does the Murrumbidgee Local Health District Board do? Now, I could give you a pretty detailed explanation based on the Health Act, but in essence, we're here to supervise and monitor the Murrumbidgee Local Health District. It's an important function, and all my directors live here in the area and are drawn from a wide array of perceptions and experiences that contribute to the good running of the board and the good conduct of its function. One of our key jobs is to oversee the development and then approve the strategic plan for Murrumbidgee. Now, we have a new strategic plan that's just been approved this year, which covers the period from 2021 to 2026. I don't want to use this opportunity to go into it. It's not a very large document at all, but it is on our website. I'd really urge you to have a look at it, to find it on the website and read through it, and so you can understand then where we're trying to take the organisation as we move into the future. Now, traditionally, a public meeting like this has been an opportunity to go through the achievements of Murrumbidgee over the last year or so and to present to you our financial reports. I'm going to leave that to the expert hands of our Chief Executive, Jill Ludford, and to the Chief Financial Officer, Kevin Lawrence. But rather what I'd like to do is concentrate a little bit more on some of the themes that are coming out for our future. I'd like to start by concentrating, obviously, I think, on COVID. Murrumbidgee, like most health agencies, has been engaged in a war against COVID throughout 2021, well, really for the last 2 years or so. And it would be fair to say that we have been challenged. Not to the same extent as, say, Sydney or even the far west of New South Wales. We're all well aware of what they have faced. And we in Murrumbidgee have been fortunate. We've had the opportunity to achieve solid vaccination rates and avoid rampant infection rates. So we have been very lucky, and this has put us in a strong position to learn to live with COVID as we move into 2022. But I want to caution you, we're not in an invulnerable position. Experience from overseas has shown us that we need to remain vigilant. We need to act safely and protect ourselves by doing things such as hand washing, wearing a mask and staying a safe distance apart. And importantly, we do need to ensure that we are vaccinated and that we seek boosters when we become available. In short, we've got to remain alert to symptoms, we've got to remain careful and vigilant, and we've got to seek testing whenever necessary. That's what living with COVID will be like. But what worries me most is that the possibility rather in 2022 that while we are coping with COVID, living with COVID, that we may see a resurgence of the flu. This year and indeed last year have been pretty good from a flu point of view, and we think that's because we've been doing the things like hand washing and so on. The possibility of a resurgent flu, though, hasn't been missed by our planners and our clinicians. And what we have learnt from 2021 is that the New South Wales Health family has an immense capacity, an enormous capacity to adjust, to surge resources and to assist areas that are in crisis as the situation demands. Sadly though, the media, often searching for a story, has tended to highlight problems and difficulties which in turn can lead to uncertainty and even a loss of faith within our community. The reality is, with regard to COVID, we have done well. Sure, we have scrabbled, but that's what happens in a war. Sometimes you do have to scrabble around a little bit, but we have done better than most other places in Australia and indeed in the world. Scrabbling or scrambling is not a sign of weakness. Rather, it's a sign of our agility to move resources around to cope with the situation as it requires. But all this has been done with some cost. And in particular, the demands on our workforce have been quite immense. And they do deserve our praise and our support. I think they've done a great job thus far. They're up for a big job, I suspect, in 2022, and we should acknowledge that. They have been a rock. COVID is not over. We must all avoid becoming complacent about COVID, particularly as we go through 2022. And each of us must stay current with matters as they develop and maintain a good access to information, to accurate information as it becomes available. We must seek to deal with facts and not resort to gossip. And that point leads me to the next challenge that we face within Murrumbidgee for 2022. Apart from workforce and resources and finances, we face the constant challenge of communicating effectively with our community. The provision of timely, accurate and authoritative summaries is often distorted and even compromised by other agencies with their own roles and their own responsibilities and their own perspectives. It can be compromised by media sources that are just looking for that big story. Social media, where it's often hard to distinguish between fact and fiction. And indeed advice that we might receive over the back fence, which might be accurate, but probably isn't. So communication will be a daily challenge for us as we go into 2022. We understand that challenge and we'll strive to provide you, our community, with the best possible information that we can. The board during 2021 has undertaken a period of self-reflection, and it's caused us to consider cultural recognition and cultural leadership. So I'd like to stress the importance of culture today. Murrumbidgee invests a lot of time and energy into providing its services in a culturally appropriate way. We recognise the array of different cultures that form our community. And the board is giving cultural leadership close consideration, and will continue to do that by considering it at our first meeting in 2022. We want good cultural practices to be characteristic of Murrumbidgee. We do not want culture to stand in the way of anyone receiving good optimal care, health care. We do not want culturally inappropriate actions to disrupt our workforce from providing you with that good quality health care. What we are seeking is that anyone, regardless of their cultural background, that anyone who needs health care will feel respected, will feel recognised, will feel listened to, and will receive appropriate care that is timely and of the best possible standard. Murrumbidgee values the cultural diversity of our community, but I would like to make a special mention of one particular group of people, and that is our Aboriginal peoples, our Aboriginal community, who have inhabited these lands for eons. We have a strong desire to improve Aboriginal participation, particularly at the board level within Murrumbidgee. We have advocated with New South Wales Health very strongly, and indeed with the Minister, for an Aboriginal representation on our board. And although no decision has been made yet, I am very hopeful that in 2022 we will see an increased Aboriginal participation on the board. I'm excited by that, and the rest of the board is excited by that. It will be a great move. I mentioned workforce earlier. COVID has placed Murrumbidgee under enormous strain when it comes to workforce. Workforce shortages and difficulties are being reported just about everywhere in our economy. They don't just apply to health, and they don't just apply to Murrumbidgee. We're alert to these difficulties and these stresses, and I'm pleased to say that the search to find innovative workforce solutions is well underway. The workforce executive within MLHD are a very talented team, and the issue of workforce has been a high priority throughout 2021 and will remain so in 2022. The solutions to workforce, though, are not just a matter of spending more money to employ more people. In fact, Murrumbidgee now employs more people by about 2.5% than it did at the start of 2021. But rather, the solutions to workforce revolve around us recognising and using skills in new ways, thinking about the responsibilities of individuals and how we can change those, being an attractive employer, and being agile in our solutions as we apply those to the workforce. We've got a lot of work to do here, but I'm quite confident that we're on the path to making some great successes. Now, the board has had a number of areas of focus beyond COVID, culture, and the workforce. And one of these areas is that we are seeking to understand our financials far more closely than perhaps we've ever done. Broadly speaking, our budget are the funds that we are given from the federal government and the state government. And the amount of money that we're given is really the result of a series of formulas and criteria which are applied in good faith, but represent or determine the amount of money that we receive. Until now, we've had very little option but to accept that. But we have developed a view that such formulas and criteria do not necessarily recognise the unique characteristics of Murrumbidgee. So in 2022, we intend to throw a different analytical framework over our financials. And if a new way of budgeting emerges, then we will take our analysis to New South Wales Health in the first instance. Now, I'm not forecasting that this is some sort of battle with New South Wales Health, not at all. In fact, we have a very good relationship with New South Wales Health, who work with us, as I say, in good faith. But what we are trying to do is seek to understand things in greater detail than ever before and develop a well-researched, fully detailed and cogent case to ensure that the funding that comes to Murrumbidgee is fair and is reasonable. The board has also been keen to pursue discussion as to the nature of future care. This is a little bit longer term. If anything, COVID has shown us that people who are unwell can often get good care by being supported out of hospital. For example, Murrumbidgee has provided comprehensive care and quality care at home, and for others it's been provided in supported motel accommodation. This has been a similar story across the nation, across the state and the nation. And we know that where possible, most people prefer to stay at home and to be cared for rather than spend their time in a hospital. Now, we know also that if we invest in measures to keep people out of hospital, then that will lead to better health outcomes overall. If we can avoid serious disease by starting treatment early, for example, before a condition becomes too advanced and requires some dramatic intervention. We're also seeing new methods of surgery develop. For example, one that I've cottoned onto is hip surgery, where the time that you have to spend in hospital after an operation is dramatically reduced. It is the best care. So a lot of things are on the plate there about where a hospital sits these days. So it's that future of hospital-based care that we're looking at very strongly. There will always, of course, be people and conditions that warrant treatment in a hospital, but there are those new options on the horizon, and we want to be sure we understand those. We're in the very early days, of course, of considering these issues, and we will not rush change, but it is right that we look to the future with open minds and consider all the possibilities. Now, I know that even though I've said we're looking to the future and considering all sorts of possibilities as we aim to become more efficient and more effective with resources, I know that the moment some health bureaucrat says that, then communities will immediately start to worry that services are going to be cut in some way. So let me reassure you, Murrumbidgee, the MLHD, does not have the authority to cut any services, and we don't aspire to cut any services. We simply aspire to give you the best quality care and to be as efficient and effective as we possibly can with the resources that we have. And we don't care whether you live in Wagga, Ungary or here in Young where I live. We are seeking to give you the most efficient care and maintain good quality care. That's our aim. I'd like at this stage to make a note about the local health advisory committees. They are an important component in this whole process of going forward because everything I've said relies on communication between us and the community, and indeed between the community and us. I know that the process of keeping the LHACs informed has been a little bit, well, let's say mucked around by COVID. But I want to stress here and today that the LHACs remain an important function within Murrumbidgee, and we stress the importance of those, and we'll be looking to keep the vigour within the relationship and move things along. Their role in communication is vital as far as I'm concerned. Now, a final note, if I may. My appointment as chair follows the many years of service of my predecessor, Gail Murphy. Her enthusiasm, her energy, her keenness to advance the best possible for Murrumbidgee are well known and deserve acknowledgement today. I've got to say it's a little bit daunting to follow in Gail's footsteps, noting how widely she is respected around the region. Gail certainly deserves wide and high acclaim for all that she's done. It would be remiss of me not to make mention of her today. So I say this, thank you, Gail Murphy. On behalf of Murrumbidgee, thank you for your service and thank you for your considerable endeavours over the last, well, I think decade or so. In turn, I'd like to thank you, our community, for attending today. Thank you for your interest in being here and therefore your interest in how we deliver healthcare within the Murrumbidgee. And thank you for your ongoing efforts to remain engaged with MLHD. I wish you all the best as we move into the festive season. I wish you all the best for 2022 and I urge you all to stay safe.
Thank you very much, Dr Douche. I think, Millie, you'd agree, quite incredible the passion that Dr Douche has for rural and regional medicine, and obviously him and his board have that strong commitment to our communities that cover the Murrumbidgee Local Health District footprint. So we're most grateful to Dr Douche, that's for sure. It now gives me great pleasure to introduce another much-loved figure across the Murrumbidgee Local Health District, and that is Chief Executive Mrs Jill Ludford. And Mrs Ludford will provide an overview of the district's achievements over the past year, and we very much look forward to listening to her.
Good afternoon. My name's Jill Ludford and I'm the Chief Executive of the Murrumbidgee Local Health District. The year in review was a year like no other. As our health service focused on public health issues, we also worked to ensure that we kept our links with communities and that we kept all of our health services moving forward. This afternoon I'm going to talk you through some of the achievements from the year 2020 to 2021. I'm going to start with some key highlights. Many of us during this period were in long periods of stay-at-home orders and were unable to travel and connect with families. That included myself. I was unable to undertake my usual road journeys out visiting our facilities and linking in with our staff, our communities and our councils. Face-to-face connection will never be replaced with virtual meetings, but we all got really great at doing virtual meetings and I can't wait to be back on the road and out and connecting with our communities. As a rural health service, connecting with our people is one of the singly most important things that we need to continue focusing on, involving our families, our communities and our patients and consumers in the development of care as we move forward. So some of the highlights. The first one I want to talk about is the New South Wales Government's signing of a local decision-making accord here in the Riverina Murray. It is very, very important that we work with RIMRA, the Riverina Murray Regional Alliance, on developing culturally informed care across all layers of government. We in health are absolutely committed to working with RIMRA and want to recognise the work that they have done in putting forward their priorities to move forward. Health and healing, strengthening families, housing, reducing incarceration and justice is very, very important for our Aboriginal communities. Then I want to talk about how we're elevating human experience. Does sound a little bit jargonistic, but over time, clinicians are very focused on delivering the right evidence-based clinical care. But what we recognise now is it's not just about the clinical care, it's about how you feel when you are in our facilities or when you're in our care and the experience that you have. How do we communicate with you? How do we link up all the messages between all the various clinical teams? That's what we call the human experience. But it's also about the experience for our staff, who, if they're happy, will give you a positive experience as well. As one of these initiatives, we have put into 2 of our emergency departments patient experience officers, and their job really is kindness and caring for you while you wait to be seen by your clinical teams, making sure that you have what you need, your phone is charged, and that you understand the waiting times, and that if you have any clinical needs that are urgent, that these are then communicated to the teams. We've had overwhelmingly positive feedback about how patient experience officers help people in their greatest times of need. We've also started collecting what we call patient-reported measures. Again, sounds very bureaucratic, but rather than just collecting timestamps and KPIs that are very much about numbers and metrics, we are now collecting outcomes for people that matter to them. Things such as how they are getting on after an operation, how they're getting back into their normal life, the length of time it takes for them to get back to work, and the effectiveness of their treatment. This is really important for clinicians to understand when talking about the holistic care of people. Also, getting in prevention and early intervention is an important part of the work we do. It's not just about treatment, it's about wellness. So one of the first year milestones for a very important program that we've undertaken is the early intervention family support. This program works with community leaders in identifying families who have got really complex needs. Getting in and working with those families, with the other service providers, and linking them with the right referrals and support really gives them that holistic care that they need to give their children the best start to life. And moving on now to surgery. Last year, during the pandemic, we had to defer some of our surgery, our non-urgent planned elective surgery, to enable our clinical staff to be retrained to be able to care for people should we need them in intensive care. During the last 12 months, we undertook all of our booked surgery and all of that make-up surgery. And on the 30th of June, 2021, we had no patients overdue for planned elective surgery. And we undertook 13.3% additional surgery in that 12-month period. So huge thanks to all of our perioperative staff, our doctors, our nurses, and we did lots and lots of joint replacements in that time to make sure that people could get out and back into their normal lives. Living well your way, this is about chronic disease, but it's a whole new way of treating people with chronic disease. Instead of people having their GP care over here and then having to come in and out of hospital, it's about joining it up, getting in early and creating a pathway. It is a collaboration with the primary health network, not just the local health district, and joining in the work that our physios out in the private sector, that our GPs are doing. But best of all, the whole pathway has been informed by our consumers. And it was not what we expected, but if we have that care pathway and we fill in the gaps for people, that will help people to stay out of hospital and to have a much healthier, happier life. I want to talk also about some other holistic care we did, some care we did with the Brungle community near Tumut. It was a multi-agency health expo, a beautiful day where we all came together at the Brungle Health Centre. And our Aboriginal communities really wanted us to bring all the agencies together to show how we can deliver wellness, holistic care, and all of the different types of services that are available right across our region. It was all about also ensuring that the care we provide is culturally informed and culturally safe for our Aboriginal people. And we are absolutely committed to working with Aboriginal communities in bringing those multi-agencies together to help inform the care that we deliver. And as our board chair has already mentioned, work occurred in the year in developing a new strategic plan, Exceptional Rural Healthcare. It builds on the last 3 years' strategic directions, which are all about our people, excellence in clinical services, and focusing on wellness. And the plan sets us up for the next 5 years for a very bright future. Now, as Chief Executive, I now need to move on and talk about some of the achievements that we have made in terms of activity. So I'm just going to give you a few numbers here now to help highlight the enormity of the area that we cover and the numbers of episodes of care that we deliver. So let's start with our emergency departments. Over 140,000 people presented for emergency care right across the Murrumbidgee region. And we have those emergency care centres open 24 hours a day, 7 days a week, even Christmas Day and Easter. We also deliver care outside of the hospital setting. 973,800 episodes of care were undertaken outside of the hospital setting. That's our teams like community nurses, our community mental health teams, allied health clinicians, our clinics. It's very, very important care. Care is not just about hospitals and beds. But speaking of those, we did nearly 20,000 surgeries last year. As I said, 13% more than the previous year. And in our hospitals, 2,175 babies were born and started their life. At the other end of the spectrum, we care for nearly 350 aged care residents as a major aged care provider across our region. Chronic disease is an enormous issue facing rural health services, and we undertook 13,798 episodes of renal dialysis, and renal dialysis is one of our fastest growing clinical services, growing at a rate at the moment of about 30% on last year. All of this work cost the taxpayer $734 million, and of that we spent $33 million on COVID-related care as well. I'm going to move on now to talk about some of our innovations, and that we have some projects underway that are actually first in state. And I want to start with training doctors. We know there's a shortage of GPs right across our region, and rather than sitting back and watching as fewer and fewer doctors started to undertake GP training, let alone in the rural sector, we decided to do something about it. Rural generalists are different to GPs. They're GPs who have got advanced skills that skill them up to be able to work in a small rural hospital, things like anaesthetics, delivering babies, emergency department, mental health, palliative care, all important skills to be able to work in the rural sector. The pathway as it existed was piecemeal, and it didn't give trainees equal status with the other specialty training programs. So we've undertaken to employ GP trainees and give them a positive experience, give them all the benefits of being employed for that 4-year period while they go through their training program, and offer them really great mentoring, supervision and quality support and assistance. We have 5 trainees who have joined us this year, and we're very, very proud of the work that they're doing. In another program, a first, Arts in Health. Arts in Health came along with Health Infrastructure and New South Wales Art Gallery. It's something for our aged care residents, and as we were building some of our new MPSs, in particular Murrumburra Harden, Culcan and Tumbarumba, we saw there was a need to enhance the holistic care of our residents. We are building their homes, and what do we have in our homes? We have social and culture. Art provides just that. And Art Galleries New South Wales have provided some absolutely beautiful artwork and relevant activities around the art that forms that connection point for residents. It's something to tell stories about. It's something that evokes emotion with people, to talk with their families. And best of all, our staff are also involved, and it's also given them a greater connection with our residents. During COVID-19, it was absolutely invaluable. And the Murrumbidgee Stroke Service. The Stroke Service is a multi-award winning service, and it is led by Professor Martin Jude, Catherine Moore, and a whole team of allied health and nursing professionals. They were awarded the prestigious World Stroke Organisation's Angel Gold Status Award in November of 2020. It was recognised for best care, meaning all the highest standards in stroke treatment. It is the first in Australia to receive such a prestigious award, and we are extraordinarily proud of the work that they're doing, but best, the outcomes, life and death outcomes for people in our region. And you'll see a picture there of Professor Jude. Other innovations have occurred also. I want to talk about a few of those that are both ICT related, which is digital technology, but also some of the innovations that we're doing in how we care for people in our wards. They say necessity is the mother of invention, and of course, because we're a rural health service, sometimes we have to be more inventive. We have a very large geographical area that we need to cover, and we've all become absolutely expert, as I've already said, at using Zoom and Teams and all those other digital platforms. But during this time, we realised that we needed to enhance the infrastructure to make digital technology easier for our people in community, but also for our staff. It needed to be foolproof, it needed to be simple. So the telehealth capability was enhanced enormously over this period, which was perfect with the COVID pandemic, where we had to move to delivering virtual care as staff who were in lockdown were unable to travel as part of their work. My Virtual Care is a brand new platform. It has a virtual waiting room. It's on our Murrumbidgee website and it's simple to use. Clinicians were able to book appointments to see their consumers, their patients, and click into the waiting room and bring their patients in and still see each other and connect in that way that is so important. Telephones are not virtual care. You really need to be able to see somebody, connect with them and build that trust and rapport. At the same time, the virtual care in our emergency departments also needed to be upgraded. The new cameras that we've put in there that provide ultra clear pictures, the best thing about them is they don't go down and they're foolproof for our staff. Flick a switch, it's on, and you're connected with who you needed to. And all that work is recorded and goes into the patient record. Very, very important infrastructure for a rural local health district. A couple of clinical innovations. The first for a Riverina area is in surgery. So day-only hip surgery. Day-only hip surgery might not be for everybody, but for people who don't have other health related illnesses, having your surgery and getting back to work, to sport, to your usual activities is really important. Day-only hip surgery sees a spinal anaesthetic, up out of bed and walking within 4 hours of surgery, and then home on a specialised program supported by our physiotherapists and occupational therapists. All of our consumers who have been involved in that have absolutely given it the thumbs up. And finally, our safe wards. This is an innovation that's being undertaken by our mental health services, our admitted mental health patients. It's a new initiative to support consumers in the acute mental health setting. And it's all about involving peer workers with a lived experience in mental health, and our staff draw on their own experiences to educate the staff and ultimately improve the interaction with consumers and improve interaction and outcomes for our mental health patients. Part of the program is about reducing the stigma around mental health by fostering open discussion in a safe environment. Participants share their own experience and health journeys, leading to better understanding of people who are going through a similar experience. And now on to some of our buildings and infrastructure. We have been very fortunate over the last few years to have the opportunity to expand and build some of our new hospitals. I want to talk about the 4 that we have focused on over the last 12 months, and not to forget that we have some other rural minor works that have been undergoing planning, and those are in Deniliquin and Leeton, and we look forward to that work being undertaken now in this financial year and seeing those enhanced emergency departments for Deniliquin and Leeton. But let's start with the Tumut Health Service, which is the first redevelopment of a district hospital in our region. It has been an extraordinarily rewarding project, engagement with the community, engagement with the Aboriginal consumers in the region, and our staff absolutely embracing an opportunity to do things differently. District hospitals are very, very important. All of our district hospitals provide acute care and reduce the need for some of our patients to have to travel all the way to the bigger base hospitals. So building Tumut, which has a renal unit, enhanced surgery, birthing services, and enhanced technology and equipment in medical imaging will be very important to reduce the need for patients to travel to Wagga Wagga. On the other end of the spectrum and the other side of our district, the Hay Health Service has wonderful aged care services, but really needed some modernisation, and some of the flows within the hospital too were not quite right. So we were able to use some of the funding from the MPS redevelopment program to do some enhancements to Hay Hospital, which have just been completed and are very exciting. New aged care rooms that give more areas for people to undertake activities, and really improving the flow in the emergency department and really importantly for Hay, one of our more remote health services, brand new staff accommodation. People who work in Hay may live out on properties a long way away, or we might need to bring in students or agency staff. So enhancing our accommodation for our rural hospitals is and continues to be a very, very important focus for Murrumbidgee Local Health District. Griffith Bay's hospital redevelopment is moving along, and the work that we saw in the 12 months was about planning for the non-clinical services block, which then enables the acute service block to start building, which is in 2022. That will enable the site to clear all those old buildings at the back of the hospital, ready for the new hospital build. We've also planned and now opened the temporary paediatric wing, and I do want to thank all of the staff who have been heavily involved at the same time with the detailed planning of the acute services block, which is looking absolutely beautiful. We look forward to that construction in 2022. And finally, the Wagga Wagga Stage 3. Whilst we still have the car park, which is under construction, this was the final part of the actual hospital redevelopment. And the Health Services Hub is home now to a range of ambulatory services as well as inpatient admitted services. It's home to a huge new renal dialysis unit that's got educational and home dialysis teaching facilities. It's home to our rehabilitation wards, our specialist mental health aged care wards, and also to aged care services. Best of all, it brought 60 services together in one building, and the ambulatory care clinics and those consultation areas are beautiful. And it was designed specially understanding that people from right across our Murrumbidgee region may be there for some days, and we needed to provide families and visitors with a place to rest, a place to eat, while they are looking after their loved ones in hospital. It's a beautiful building, and you can see a picture on the screen now. Just moving on to our people. Whilst I'm going to talk about two people who have won awards this year, I do want to also recognise all of our staff, not just our doctors and nurses and allied health clinicians, but all of the support staff, the asset management teams, the administration teams, the finance teams, the people and culture teams. Thank you for all you have done. You continue to exceed expectations in caring for people in our communities. But there are two people I want to point out now. The first, Kieran Preston, 2020 New South Wales Nurse of the Year. And I was there when that award was announced, and my whole body was tingling. Kieran absolutely personifies nursing in Murrumbidgee. He is known for his kindness and his compassion as he cares for people in the mental health setting. And his trait of empathy for others is hugely appreciated. And congratulations to Kieran, who is an amazing nurse. And another person I wanted to point out was Jenna Weymouth, a proud Wiradjuri woman who we are also proud of. And she was the 2021 Aboriginal and Torres Strait Islander Student of the Year for TAFE, Riverina TAFE, New South Wales. She completed her Certificate for an Aboriginal and Torres Strait Islander primary healthcare practice. Her passion lies in providing Aboriginal health services, and this work that she has done enables her to progress from an Aboriginal health worker to becoming an Aboriginal health practitioner, not only supporting her patients socially and emotionally, but now being able to care for them clinically as well. Congratulations, Jenna. We are very, very proud of your achievements. And then we can't finish off by talking about the year without talking about the pandemic response. And as we reflect, we can't do so without acknowledging the enormous changes that our healthcare clinicians have made during this time. We are still working under emergency response procedures. 20 months we have been going through this, and our people have gone out. Nearly every person you meet who works in the health service has somehow or other had their job changed or their role changed, or have gone above and beyond over the last 20 months. As I've already thanked them, I want to thank you now, our communities, for the recognition of our healthcare workers during this time. They have stepped up. They've stepped up to keep you safe. Just a quick look at some of the work that they have been doing. COVID testing, not only in our static clinics, but in the COVID testing vans that have gone out to even the most remote villages across our region when the need was there. Up until June 2021, we had undertaken nearly 124,000 COVID swabs and tests, the majority of which were able to be locally processed here in our New South Wales Pathology Laboratory at Wagga Wagga. During this time of long periods of lockdown, long periods of time where people were not able to connect with their family, border closures, border restrictions, no overseas travel, our workforce was enormously impacted. We have relied for many years on staff coming in to work in our region and going out again, and this was not able to occur. And it has placed enormous pressure on the staff who will remain to be able to work up and fill some of those vacancies. Our staff were trained in intensive care to be able to care for our COVID patients. Our staff are retrained to care for patients in isolation at home with COVID-19. Also, we have administered during that period 17,000 doses of the vaccination into the arms of our staff, first responders, elderly aged care, and then the greater population. During this time, we spent $33 million on our COVID response, including extra efforts to decrease our surgery waiting lists, assessment clinics, and of course, the additional PPE that was required to keep our communities and staff safe. And now with an impressive population vaccination rate of first dose at 97.3% for those aged over 16, and not over 90% people fully vaccinated, we are now working in a different way. We're working around living with COVID, and as we still continue to see outbreaks now, the community has a layer of protection that was not there before. So now, in closing, the past year has been an incredible journey and a learning experience for absolutely all of us. I want to extend my thanks and appreciation to the Murrumbidgee Local Health District Board for their work and guidance over the last 12 months. It's been a time of rapid change with our response to COVID-19, even in the last few months, as we've continued to experience and respond to outbreaks across our region. I would also like to acknowledge the work and dedication of all of our volunteers, our hospital auxiliary workers, our local advisory committee members, the volunteers who help with wayfinding, the volunteers who come into our multi-purpose services to assist with our aged care activities, and many more. Thank you so much for the work you do that also helps to care for our patients. Thank you. Reflecting on the year that was has made me incredibly proud of the exceptional work still being undertaken by our health service for you. We've worked together in challenging times and heightened anxiety. Exceptional care has continued to be provided to our communities through our workforce doing what they do best. And importantly, we've kept each other safe. As Chief Executive, I can't be more honoured to represent our entire workforce and to represent these achievements that puts the spotlight on our continued dedication to providing safe care for you across our region. Thank you.
Thank you so much, Jill. We're all very privileged to work with such a passionate Chief Executive. We will now hear from our Director of Finance and Performance, Kevin Lawrence, about the Murrumbidgee Local Health District financial position.
Thank you. My name is Kevin Lawrence. I'm the Director of Finance and Performance for the Murrumbidgee Local Health District. Today I would like to go through the major points of interest with regard to financial results of the Murrumbidgee Local Health District for the 2021 financial year. I would also like to spend a little bit of time discussing the impacts of COVID on our activity and our finances. Murrumbidgee Local Health District is reporting a net surplus of $69.8 million, with revenues exceeding total expenses for the year. It is, however, important to note that the LHD was budgeted to exceed revenue by $66 million, and as such reporting an unfavourable position of $3.8 million for the year. The LHD reported expenditure of $734 million against a budget of $712 million, an unfavourable position of $21.8 million. The LHD continues to face a difficult financial environment, with this year's result being a slight improvement on the prior year and improved by $2 million. The 2021 financial year has been an extremely challenging year with the ongoing impacts of the COVID-19 pandemic response. The LHD continues to work closely with the Ministry of Health and other relevant stakeholders to improve the financial sustainability of the LHD. Total expenditure increased 5% compared to the prior year, with expenditures on the COVID response contributing $21 million to this increase. Employee-related costs were generally in line with the prior year, with an accounting adjustment for long service leave reducing the reported expenditure levels. Other expenses increased by $24 million this year. Approximately half of this increase was associated with the COVID response. Increases were also seen in capital expensing of $3.7 million and health technologies an additional $2.6 million. Depreciation also increased relative to the prior year, with recent new capital builds now being depreciated. Revenues increased slightly year on year, with recurrent allocations increase of $46 million being offset by reductions in other revenue streams. Increases in recurrent allocations resulted from the Ministry of Health support for the LHD's COVID response, totalling about $33 million, and the increased budget funding as part of the FY21 service level agreement. The Statement of Financial Position, or the balance sheet, is a statement of the LHD's assets and liabilities as at the 30th of June 2021. The LHD's asset base has increased by $70 million in this financial year. Most of this increase is associated with an increase in non-current assets for the organisation, with capital asset additions increasing the asset base. I will provide further details on the capital program shortly. Overall, liabilities remain consistent with the prior year. A reduction in payables were offset by an increase in employee leave provisions. Impacts of COVID and surgery programs impacting the ability of staff to take leave. As you can see, New South Wales Health continues to invest in capital programs within the LHD. Significant financial investments were seen at Wagga, Griffith, Tumut, Harden and Hay, with a number of other facilities also having capital improvement programs undertaken. As everyone is aware, COVID-19 has had a significant impact on society. I would like to take a little bit of time now to illustrate how COVID impacted on the activity of the LHD and also provide information as to how the LHD responded financially. The LHD spent $33.1 million in response to the COVID-19 pandemic in the 2021 financial year. It is important that we recognise that the LHD was supported by the Ministry of Health, who provided significant financial assistance to the LHD in our response. As you can see, major areas of expenditure were the waitlist reduction and outsourced activity program, which is about $7 million. Pathology, we spent approximately $6.7 million. We spent approximately $3.8 million on providing PPE for our staff. Our COVID clinics cost us approximately $3 million. Mental health, about $1.7 million. ICT telehealth, $1.1 million. And with the emergency management program, about $1.2 million. COVID also has had an impact on our activity. Our bed days remained lower than prior years, with signs of normalisation seen in the last 5 months. Much of the activity increase was driven by the surgery recovery program, particularly at Wagga Base and Griffith Base hospitals in the second half of the year. Bed days at the rural sites remained low relative to prior years, but did show signs of normal activity over the last 4 months of the financial year. Overall, mental health bed day activity remained lower than the 2 years prior, but bed days for mental health increased in the second half of the year as bed capacity for non-COVID activity returned to normal levels. Activity for renal dialysis has increased in each of the last 2 years, with activity this year 27% higher than 2 years ago. Most of this increase is seen at Wagga and Deniliquin. Surgery levels increased 13% last year compared to the prior year, with an additional 2,252 surgery cases. Surgery was also higher than the 2018-2019 financial year, up 1,215 cases. Most of this increase resulted from the additional surgery to catch up from the impacts of COVID, with activity reducing in Q4 of the FY20 financial year. By the end of FY21, the number of patients on the waitlist had reduced by nearly 700 and was back to similar levels 2 years ago. The LHD had no surgical overdue patients at year end. ED activity remains suppressed relative to prior years. FY21 is down by about 5.5% compared to last year and was lower than FY20 by about 11%. The reductions in activity were most evident in triage categories 4 and 5. The reduction in ED activity was mostly seen at Griffith and the regional sites, with ED activity at Wagga Base normalising early in the financial year. Overall, non-admitted activity has increased 14.8% compared to the prior year, 17.7% compared to 2 years ago. COVID contributed significantly to this increase. Adjusting for COVID, the relative increases are 3.8% compared to last year and 3.3% compared to 2 years ago. Virtual health activity increased during the pandemic. The LHD pivoted to virtual services quickly in the last quarter of FY20 when the pandemic started. Activity has returned to a new normal this financial year, which is slightly higher than the pre-pandemic levels. The LHD has recently received its formal 2021-22 service level agreement, which contains the budget allocation for this new financial year. The LHD's expense budget has increased by over $29 million, or 4.4%, to a total of now $687 million. The own source revenue targets have decreased by approximately 1.7%, or reduced by $1.9 million, to a target total of $106 million. As usual, the audited financial statements are available on the MLHD website. Thank you for your time.
Thanks very much, Kevin, for that most detailed analysis of the financial position for the Murrumbidgee Local Health District. And it's very obvious, I think, Millie, that he loves his role, that's for sure. But it's also a reminder, I believe, about how blessed we are across the region to have such significant dollars invested in our communities. It's something very special and something we don't take for granted. We now have the opportunity to put questions to our distinguished panel today, and the panel will be, of course, our honoured guest speakers from today in Professor Jill White, our Board Chairman, Dr Tom Douch, our Chief Executive, Jill Ludford, and of course our Director of Finance and Performance, Kevin Lawrence. So there are a number of questions that have been put on notice, would you believe? So we'll begin with those, but you can also submit your questions by going to slido.com, slido.com, and entering the code in Murrumbidgee Local Health District, MLHD.
So our first question today, what has happened to the Career Medical Officer role at Leeton District Hospital?
Right.
And Professor Len Bruce is going to respond to this question. Thank you.
So the Career Medical Officer position at Leeton Hospital has been advertised for a number of years, unfortunately without being able to recruit suitable applicants. CMO remuneration in public hospitals in New South Wales is bound by the Health Professional and Medical Officer State Award of 2019. And unfortunately, in the current climate, the standard CMO award package is not competitive. And that is due to a number of reasons, and probably the most significant impact has been the effect of COVID on the availability of medical staff and also increased needs to staff emergency departments during the pandemic. The commitment of the Murrumbidgee Local Health District to provide medical services to our community is unwavering. And what we are busy with at the moment is to develop a new engagement model which will provide better remuneration but also more attractive conditions to allow us to recruit suitably trained permanent medical staff. Unfortunately, this is a process that will take time, and in the interim, the Murrumbidgee Local Health District is engaging local medical practitioners as well as locum medical practitioners to provide 24/7 availability of medical officers to Leeton Hospital.
And apologies, that was our Director of Medical Services, Len Bruce.
Now, question number 2. The Edward River Council has inquired about the data discrepancies regarding the COVID-19 vaccination rates at Edward River local government area, and that is in the hands of the lovely Mrs. Carla Bailey.
Thank you, Rick. The Murrumbidgee Local Health District acknowledges that the public data on vaccination for the Edward River local government area is not an accurate representation of the community's true vaccination rate. There are several contributing factors to this data discrepancy, which are strongly linked to postcode records and the layout of the Edward River region. Murrumbidgee Local Health District estimates that the actual vaccination rate for the Edward River government area is similar to the neighbouring local government areas where there are high vaccination rates. New South Wales Health is working closely with the Commonwealth Department of Health to resolve this data issue, which is publicly reported, and provide a more accurate reflection of the vaccination coverage in the Edward River. Currently, in Murrumbidgee Local Health District, over 90% of residents aged 16 years and over are fully vaccinated. I would like to recognise the amazing efforts of our community who have undertaken the vaccination to protect others.
The Edward River Council has asked what the district is doing to attract new doctors and ensure that Deniliquin Hospital is adequately staffed to provide services.
The Murrumbidgee Local Health District continues to collaborate with our medical officers in Deniliquin, and we're extremely appreciative of their commitment to Deniliquin Hospital, the Deniliquin community, and also the Murrumbidgee Local Health District as a whole. When local doctors are unavailable, sometimes because they're busy in their practice or they are taking, a well-deserved break, the Murrumbidgee Local Health Districts provide local medical officers to look after the emergency department in their absence. Deniliquin Hospital also employs a full-time specialist nurse practitioner to provide support to the staff and the medical officer to manage lower acuity presentations. An additional support structure that's in place, as mentioned previously, is the use of virtual care. The Murrumbidgee Local Health District provides the remote medical consultation service for lower acuity presentations and also the critical care advisory service where we utilise the emergency department specialists to support Deniliquin Hospital and other hospitals when dealing with acute presentations. Attracting doctors to rural hospitals has been challenging, and it's probably even more so during the era of COVID. The Murrumbidgee Local Health District collaborates with Commonwealth initiatives like the Rural Junior Doctors Training Innovation Fund, and in 2022 we will actually have a resident medical officer in Deniliquin Hospital. And as mentioned previously, the Murrumbidgee Rural Generalist Training Pathway will actually have a trainee in Deniliquin next year. And we're very proud of that doctor because she would have actually completed a 12-month training position in the emergency department at Wagga Base, which will be able to support the community in Deniliquin.
me. And the final question from the Edward River Council, they've asked if the district could provide an update on the health services plan for the Nillukin region and what this will mean for the wider Nillukin community. And again, Mrs. Carla.
Murrumbidgee Local Health District are progressing a tender process to engage a service planning consultant to develop the important clinical service plan for the Deniliquin Hospital. The service plan will consider the Deniliquin community now and into the future. It is anticipated that the service planning will commence in early 2022.
The Griffith community doesn't have a psychiatrist. How can people waiting to get a diagnosis or treatment for a complex disorder receive care, and are they expected to travel?
Thank you very much for your question. The Griffith Community Mental Health Team has a large range of specialists, including visiting psychiatrists. The people in Griffith are not required to travel to access psychiatry, and psychiatry is delivered both face-to-face and also through virtual technology.
Thank you. Question number 6. Fran Gorey from the Moolameen Local Health Advisory Council has asked about the reduced services of community health care being provided to the Moolameen community and the district, including the suspension of school vaccination programs, and how these decisions will impact the community.
Thank you very much, Rick. And to all of our communities who are small communities without hospitals, Moolameen, Tooleba, Moama, and we have many across our region, I do want to reassure you that healthcare delivered to your villages are very important to us. During the COVID pandemic, a number of our community nurses put their hands up to help keep the community safe at a different level. We saw community nurses undertaking COVID testing, COVID vaccination, and also supporting some of the care of COVID patients in the home. During that time, there were some changes to local services, but my message today is I would like to reassure you that your community nursing services are now on the road back to normality. And as for school vaccination programs, whilst many of those vaccination programs were able to continue, there were a number of schools who chose during their COVID safety plans not to continue with school vaccination. But they are all on the way, happening again now, and make-up clinics will certainly occur in all schools in the new year. Thank you.
Thank you, Jill. John Harvey from Murray River Council has asked if the district could please explain the rationale for significantly reducing the community nursing services across the Murray River Council local government area.
Thank you. And another one of our fantastic smaller communities. And I just want to reiterate the message that I just gave us, that a number of the community nurses were part of our COVID response teams. And I do want to thank them for the work that they have done, but they are also committed to your communities, and those services are now resuming. Thank you.
The next question. A generous pay rise is desperately needed to attract people to all areas of nursing, and is there a possibility of this happening anytime soon?
So to all of our nurses out there, and I might ask Jill White actually for her comments, a huge thank you for the amazing work that you do. In New South Wales, nurses work under New South Wales awards, which set out the pay rates and the award conditions for nurses. But I do want to say, as we've heard today, that there are really significant rural and regional workforce challenges that we are facing now, after prolonged periods of border restrictions and changes to travel, and people really wanting to stay home, Jill, and connect with their families. So we are looking to offer incentives to attract people to come and work rurally. We are able to provide incentives in terms of travel and accommodation costs during relocation. But most importantly,
I'm absolutely committed this year into developing rural nursing as a specialty and really focusing on offering people incentives in their career pathways. But I'm really keen to hear your views.
Well, I think that there's much more that we can do in the metropolitan areas to help the students who are in the universities there understand the joys of working in rural areas and to give them exposure to that. But one of the critical parts really is educating nurses where you want them to be. So I think the engagement with the institutions that are in your areas are absolutely so important. I think also looking at nurse practitioners, looking at specialty nurses. One of the things that COVID has done, I think, is to challenge nurses, generally almost everyone who lives and works in a metropolitan area, challenge them about why they necessarily want to stay in these crowded environments when there are opportunities now to do all sorts of work outside that area. So I think in the next 12 months we're going to see a whole lot of people looking for new opportunities. And where one member of the family is a nurse, I think that's one of the driving factors that will help bring people out into the regional areas, given that their partner has a greater opportunity of being able to work virtually. So I think there are all sorts of possibilities. It is such a great job, and I think one of the things that COVID has shown us is the flexibility of being a nurse, all the opportunities that you can have. So if you're looking for a new job or a change in career, come see us.
And we're looking forward to welcoming about 80 new nurses in February as they embark on their careers in nursing. And Jill mentioned Grow Your Own strategies. We're also got 50 school-based trainees starting in the new year as well. And again, offering students who are in the final years of schooling an opportunity to work in nursing and get some actual runs on the board that will go towards their careers. So growing your own is definitely the way to go in rural.
Yeah.
Thanks.
I think also, if I could, telling the stories. There are so many stories that have come out of COVID that I would really challenge the local press to start talking to nurses about what they've been doing through the local health district, but finding out what it is that nurses actually do. What's the contemporary understanding of nursing practice? I think many of our understandings are stuck back maybe 30, 40 years ago. That's not what nursing is these days, and it's a really terrific opportunity to tell some of those stories.
Thank you, Jill.
Thank you, Jill and Jill. Our last question is from Lorraine Liebenberg, who is a member of the Deniliquin LHAC, and would like to thank the board chair for mentioning the role of the LHAC. She asks, can we expect to see increased budget allocations to our local services to run effective ongoing media campaigns and promotions?
Tom, would you like to answer this question? And congratulations too for commending our volunteers in the community.
Well, I wouldn't have mentioned the LHACs unless I thought they were important. And thanks, Lorraine, for the question. We already have a budget allocation available to LHACs who have particular ideas. I've just finished talking to Rick Furman about his LHAC and the marvellous job they're doing about enhancing the surrounds of Temora Hospital, and what a bonus that will be to Temora, both giving a pleasant hospital and also a hospital that presents well and therefore gives the feeling that this is a very capable institution to go and attend if you need help. Fundamentally though, I think any LHAC that's got an idea, it's worth bringing that idea to the executive through the CE, and funding can be made available for the right sort of ideas, including publicity. We understand the partnership the LHACs have with us in publicising and communicating with the community, so we're open to ideas. The idea of a fixed budget allocation is not quite within our purview, I don't think, but we are open to the conversation, and that's the important thing.
Thanks, Tom.
Thank you all for your questions. We will now move on to the final part of our annual public meeting today, the presentation of the Don Kendall Memorial Leadership Award. I'd like to invite the former Don Kendall recipient to present this award. Please welcome Angela Farrell.
I had the pleasure of being the recipient of last year's Don Kendall Memorial Leadership Award. It was a great honour to receive the award and to be included alongside the previous recipients, all of whom have made significant contributions to both their teams and the health of consumers across our district. Being nominated for the Don Kendall Award validates that the work you do and the way you go about it is valued, respected, and most importantly, is making a difference in all of our communities. Taking the time to nominate somebody who you think epitomises the Don Kendall values is something I encourage you all to consider when the opportunity arises each year. Back in 2002, Don Kendall's family initiated a memorial award commemorating Don's leadership contribution to the health service. Over the last 19 years, there have been many worthy recipients. The award celebrates the values upon which Don's approach to life was based. These are commitment, achievement, and pioneering spirit. These characteristics were fundamental to the way that Don approached life and approached business, and his individual style and integrity earned him enormous respect and admiration, not only in the airline industry, but also in the community. The nominees this year for the Don Kendall Memorial Leadership Award are Virginia Lang, Facility Manager at Deniliquin; Bronwyn Morley, Designated Radiographer, Breast Screen New South Wales, Southern; Phil Major, Manager, Inpatient Flow Transport Unit, CCAS, RMCS, REACH and RAS; Dr Megan Farrell, VMO anaesthetist; Vicky Macklin, Acting Nurse Educator at Griffith Base Hospital; Fiona McKern, ICU CNS and Telestroke CNC at Griffith Base Hospital. The judging panel would like to acknowledge the wonderful work of each of the nominees this year and would like to make a special commendation to Phil Major, who has gone above and beyond over the past 12 months in both his substantive role and in his contributions to the district's pandemic response. So without further ado, in recognition of Don Kendall's inspired leadership and his commitment to contribution to regional Australia, it gives me great pleasure to announce this year's winner of the Don Kendall Memorial Leadership Award, and that person is Dr. Megan Farrell. Congratulations, Megan.
Thanks very much, Angela, and we warmly congratulate all the nominees for that most prestigious award, and particularly we congratulate Dr. Farrell on a well-deserved honour. Ladies and gentlemen, that concludes the annual public meeting for today, and I don't know about you, Millie, but I've certainly had a really, really enjoyable time, and I think it reminds us all, again, as I said earlier, how blessed we are to have such a devoted board and staff from Murrumbidgee Local Health, and of course the many communities that it makes up. We really are blessed and privileged. We'd like to acknowledge the speakers for today. Professor Jill White, it was a real joy to have her. Our board chairman, of course, Dr Douche, thank you so much. Our chief executive that everyone loves, Jill Ludford, and our director of finance and performance, Mr Kevin Lawrence. And also, again, congratulations to Dr Farrell. It is a significant honour, and I know that it'll mean a great deal for your loved ones and your colleagues, that's for sure. And last but not least, Millie and I'd like to thank you all for being part of the audience during this live stream, and it's been a real privilege for us to be involved. Thank you.
Thank you.
And I would just like to extend my thanks and gratitude to our wonderful facilitators today. Millicent Brown, who we call Millie, thank you so much for all that you do for us. We are really, really grateful for the care and compassion that you show to people in our region. So here's a little thank you to you. And to Mr Rick Furman, who is a wonderful colleague in our local advisory committee in Temora. He's the mayor of the Temora local government area and a wonderful, wonderful friend to the Murrumbidgee Local Health District. Rick, thank you so much for giving up your time this afternoon. We are very, very grateful to all that you do with us. Thank you. Thank you very much.
My privilege. Thank you.
Thank you, Millie. And thanks to everybody.